Welcome back. 7:36. We know the Delta variant is spreading literally like chickenpox right now, and critics are worried that LALApalooza could be what some say is a super spreader.
Okay, so that said, both the mayor and Dr. Allison Arwady are offering us some reason for optimism. Danes reported this morning there is word that there's no plans for another lockdown. We want to welcome in the good doctor, Chicago's top doc this morning. Great to see you. Thanks for joining us.
Thanks for having me.
All right, let's get right into this. Given the safety protocols we know were in place this past weekend, how confident are you, doctor, that we're not going to see what some are calling a Lala surge?
So certainly we will see some cases associated with this event just because there are hundreds of thousands of people. But let me tell you, more than 90% of the folks attending LALApalooza were fully vaccinated and the rest were recently tested. If 90% plus of Chicagoans were fully vaccinated, we'd probably be putting COVID behind us. So we'll be watching closely and certainly, following up here. But really, I feel good about the fact that we required that for this event. And we know we got a lot of young people vaccinated to attend the event.
Now, we know that the mayor had said that if we get to 200 cases, that would be of concern. But we understand, according to the Tribune, that we reached that on Friday, and yet Lala continued. So yesterday you said this surge is different from the past two and that we need to put it all into context. What do you mean by that?
Yeah, that's exactly right. So getting over 200 cases did push us into this moderate substantial risk territory that the CDC had defined. But to be perfectly honest, we would have killed for 200 cases and 3% positivity for all of last year before a vaccine was available. There were only 13 days in the whole year last year where we were under 200 cases. And so really the one change that we've made is while we get through this Delta surge, we've asked first, folks, obviously, please get vaccinated if you haven't. This is so contagious. But secondly, we've asked everyone to put those masks back on in indoor spaces, right? Which would not have applied to Lala, but is important just while we're getting through the surge. I have no intention, we have no goal of shutting down, but we do need to be careful. And it means the combination of those two things right now while we ride out this surge.
I really think people right now, more than ever in this pandemic, they really need to be mindful of the difference between misinformation and disinformation. There's a lot of people out there who are operating under false assumptions. What do you want people to know this morning about some of the things they may be hearing which are patently false?
Yeah, so I hear a lot about this, and I encourage people, if you're reading something online or you're hearing something that sounds really scary, please talk to a healthcare provider, a doctor, a pharmacist, someone you know and trust who has the information. If you're hearing that this causes problems with fertility, it does not. If you are hearing that there is a microchip in it, there is not. If you're hearing that there have been thousands and thousands of deaths from people getting the vaccine, that's just not true. I know you might not take my word for it, but please go online to trusted, reputable sources, any of the doctor websites, any of the medical societies, or talk to a healthcare provider and get your questions answered. It's very natural. I want you to have questions about it. I just want to make sure that you're talking to somebody who has looked at the science, who understands the risk, and you're not just taking for granted something that you might be reading on Facebook, for example, because I know there is a lot of disinformation that's circulating out there.
Well, there are growing reports about these breakthrough cases among people who are fully vaccinated. And so that said, with people who went to this event, what time are you looking at where we could start to see people showing or feeling symptoms? Are we talking 3 days, 10 days, 14 days? And then with that, I want to ask you, how do you do contact tracing? Because so many people came into Chicago from out of town.
Yeah, so the good news is we have excellent contact tracing in place. And even before COVID, we had a good system for tracking people across the country. Behind the scenes, there's a system that keeps everybody's data private, but allows us to exchange whenever we're having an outbreak with movement across the country. That said, we'll be following, there can be, the reason we have quarantine for 10 days is it can take that long for symptoms to appear. We'll have a sense in a week or so. And like I said, we expect to see some cases. If people are having symptoms symptoms of COVID, not just related to Lala, related to any of the other large gatherings, related to just the fact we have a lot more COVID in the city right now, although again, good compared to where we were last year. We just want you to stay home and get a COVID test, the same recommendation that we've been giving. Don't assume it's a cold, take a test, and if you're vaccinated, you know, the concern is low, but it's no vaccine's 100%. 99.9% of the people who have been vaccinated have not developed COVID. So we're hearing a lot about these breakthrough infections. They do remain rare. Get the vaccine, please. And if you've got symptoms, no matter who you are, no matter where you've been, just take a test. You can get one on DoorDash even. It's very easy at this point.
If you had the ear doctor of business owners here in Chicago who are calling people back to the office, and those office workers are saying, wait a minute, look what's happening with Delta. It's too soon, boss. What would you tell them about perhaps letting them continue to work remotely, at least for the time being?
Yeah, so depending on what kind of situation a workplace is, there may be different considerations there. I can tell you the Chicago Department of Public Health is back full-time in person. We obviously have a very high vaccination rate here. We've had masks in the office in public settings all along here just to add an extra layer of safety. I feel very comfortable with that, again, with where we are, putting this in some context. The most important thing is if your employees are highly vaccinated and if you're working to make sure that where the public is coming in, they're vaccinated and or right now during the surge have a mask on, that risk is relatively low. But if you've got a lot of folks who are not vaccinated and or you're not checking to make sure that the people who may be coming in a public setting are not protected, there is some more risk there. But I feel, we've been back, for a long time here and not had issues.
All right. Well, Chicago's top doc, Dr. Allison Arwady, we want to thank you for coming on this morning because you've probably answered a lot of questions that a lot of people who have been talking over the weekend saw it on social media. I even posted about the concern myself. I'll admit people are watching this very closely, and we appreciate you taking the time to come on the show.
Absolutely. Vaccines are free, available. Give us a call. We'll set one up at your house. No charge. Thanks.
And on a personal note, the green looks fabulous. Thank you, doctor. I appreciate your time.
Thank you.
Let's go to